Okay, let's start with the section 2 of our lecture, Disorders of Nasal Cavity. And in this section, we will talk about the two topics, nasal myiasis and nasal synechia. So we will talk about this in this section about nasal myiasis and nasal synechia. What are these two conditions? How they present? What are the clinical features? Management of the nasal myiasis and nasal synechia. And also we will discuss another term, choanal atresia, in this section also. So all these topics are very important topics. So let's begin with the nasal myiasis. Nasal myiasis is the term maggots in the nose. So when the maggots are present in the nose, it's known as nasal myiasis. These are some pictures, very severe conditions of nasal myiasis, leading to all the destruction of the different tissues. So maggots are larval form of the flies. So what's the maggots? Maggots are larval form of the flies, and when they are present in the nasal cavity, this condition is known as nasal myiasis. So maggots, what are the maggots? They are larval form of the flies. Infects nose, nasopharynx and the paranasal sinuses. So it can affect the nose, it can affect the nasopharynx and paranasal sinuses. So it can be really severe and serious condition. Flies from genus Chrysomia affected by discharge due to rhinitis, syphilis and leprosy. So all these conditions can cause the attraction of the flies, and this can cause lay the eggs, and then the larval form develops, which is known as nasal myiasis. So discharge due to rhinitis, syphilis and leprosy, they attract the flies. These flies lay eggs, and then the maggots are developed, which is the larval form of the flies. Rate of egg laying is 200 at a time, so it's a very high rate of laying the eggs. So the conditions develop very fast and rapidly because of the big number of the laying of the eggs. Clinical features of nasal myiasis, these are the flies that can affect. So first 3 to 4 days, maggots cause irritation, sneezing, lacrimation and headache. So initially in the beginning, first 3 to 4 days of nasal myiasis, what happened? There is headache, sneezing, lacrimation, irritation, all the features like common cold or allergic rhinitis. So usually the patient is not as alert of the condition because these symptoms are very common in the allergies or rhinitis. Then there is release of blood-stained discharge. After that, then the condition becomes severe, and there is pussiness of eyelids and the lips. Destruction of the nose, sinus, face, palate and eyeballs, and then after the puffiness develop, then there is destruction of the different areas or different tissues. Fistula formation occurs. Fistulas, as a result of the destruction of the tissues, what happens? There are openings formed. Fistulas are connection between two structures. So when the tissues are destroyed in the nose, in the sinuses, then the fistulas are formed between the palates, eyeballs, and nostrils, and these fistula formations finally lead to the spread of the infection to the brain and the meninges, which are the lining of the brain and spinal cord, and death can occur as a result of infection of the meninges. So with these clinical features, now we notice that it's a very bad condition because it begins initially with the symptoms which are common to all the different rhinitis, common cold, and then slowly it becomes after 3 to 4 days, slowly there is blood stain discharge, and then there is destruction of the tissues, fistula formation, and spread of infection, and the maggots to the meninges can cause death from the meningitis. Treatment is picked up of maggots with the forceps. So maggots can be picked up and removed with the forceps. Here you can see the maggots. Then installation of chloroform water and oil. And this chloroform water and oil is usually cause the numbness, and then the maggots are easy to pick up and remove. So chloroform, water and oil. Nasal douche with warm saline, removal of slough, crust and dead maggots. So after this, then we should remove the crust, sloughs and then the dead maggots. Avoidance of contact with the flies, because the different secretions which are attracting the flies, that should be avoided. So once the flies are avoided, then there should not be laying eggs and larval stages, so all this can be avoided. And then instruction for nasal hygiene is very important. Explain to the patient how they should take care of the hygiene of the nose. So it should be clean, drained, and any secretions, they should be removed and cleared. So this is the treatment of the nasal myiasis, and usually the maggots are removed after they are dead or they become so they should not be moving when they should be removed, before they can be pushed further. So maggots can be removed by instilling chloroform water and oil, and then they can be removed easily. Next is the condition known as nasal synechia. Nasal synechia are formed as a result of injury, and this injury can be intranasal operation. If surgeries are performed on the nasal cavity, usually this can lead to the formation of synechia or adhesions, and surgeries can be like simple removal of the polyps, which is polypectomy. This can lead to synechia formation. Then severe infections causing ulcerative lesions. When ulcers are produced, the healing of these ulcers or ulcerative lesions can lead to the formation of nasal synechia. Synechia formation, usually nasal obstruction or drainage from sinuses. So whenever synechia are present, they can lead to nasal obstruction or secretions or drainage. This is a very clear picture of synechia formation. You can see these are the adhesions present in the nasal cavity. Treatment of synechia is definitely the removal of adhesions or synechia, so patient can breathe better and obstruction can be removed. Placing a thin silastic or a cellophane sheet usually is done. Change every 2 to 3 days till healing is complete. So synechias are removed. After the removal of synechia, a silastic sheet is placed which can leave the nostrils, so they should remain open, and so the healing should be better. So, and then once the healing is done or is complete, then they should be removed here. The third term we will discuss in this section is the choanal atresia. It's the condition in which there is a persistence of bucconasal membrane. So if the bucconasal membrane is present, this can lead to choanal atresia. Unilateral or bilateral, it can be one side or it's both sides. It can be complete atresia or incomplete atresia. In 90% of the cases, it's bony, and in 10%, it's membranous choanal atresia. In this diagram, you can see this is the normal nasal passage, but in choanal atresia, this is the bone blocking the nasal passage. So nasal passage is blocked in atresia and is due to persistence of the bucconasal membrane. That's how the normal nasal passage looks like, but in this condition there is a bone and this is obstructing the normal nasal passage. Different types, we have unilateral, which is more common. So it's more common on one side of the nasal cavity. Remain undiagnosed till our adult life because it's only on the one side. The other side is functioning properly, so the diagnosis is usually late and it's not diagnosed until late in life. The bilateral one presents with respiratory obstruction, so it's bilateral, it can cause respiratory obstruction, diagnosed early, managed and treated also early. The diagnosis of choanal atresia, usually there is presence of mucoid discharge, absence of air bubbles in this discharge. So in choanal atresia, when the nasal passages are blocked, usually the air bubbles are not present in the mucoid discharge. Failure to pass catheter from nose to pharynx as a result of the obstruction. Dye insertion and checking its passage. So if when dye is inserted, definitely if the catheter cannot be passed, then the dye won't pass also. So that tells us if there is obstruction or atresia. Flexible nasal endoscopy can be performed to look for the atresia. Radio-opaque dye in nose and then lateral film is taken to find out if there is nasal atresia, choanal atresia. And then CT scan can also be performed to look for choanal atresia. Treatment is emergency management in case of bilateral. It's as I mentioned that bilateral type leads to severe respiratory obstruction, so needs immediate treatment or an intervention to avoid the complications. In children, and especially McGrovern's technique is used, which then obviates the need for tracheostomy. Definitive treatment is tracheostomy. And then some other methods are nasal endoscopy and drilling, and removal of part of posterior nasal septum septum transnasally. So other methods which can be used is drilling and then the removal of the posterior part of the septum. This can be performed through nasal to ease out the breathing and to create a passage for the breathing. So these are the different treatment options for choanal atresia. So nasal myiasis, then we did the nasal synechia and then choanal atresia. All these terms, if unilateral, its obstruction cannot be as severe, but bilateral, especially choanal atresia, needs emergency treatment and management. So this is the choanal atresia and how it is managed. Thank you for watching sqadia.com.